So we will go ahead and get started. I want to thank everyone for joining us this afternoon. Um, I am really excited about this presentation, and we're so grateful that Dr. Frene Lacour-Chestnut is able to join us today and give this presentation. I just want to do a quick introduction before she gets started. So I am Kayla Rogers. I am an Education and Outreach Coordinator for the Women's Fund. We are a nonprofit in Houston that offers health education and resiliency information to women and girls so that they can be advocates for their own health. We do this through free publications, and you'll actually have a link to our publications within the presentation, and also through presentations like our curriculum-based classes and the ones like this one that you're seeing today. I just want to go over a few house rules. The first is I ask that everyone mute themselves for the presentation, just so that we have limited distractions. And the second is, if you have any questions, please add them to the chat. I will be checking the chat at the end, and I will be asking the questions for you. So if you have any questions anytime during the presentation, feel free to add them into the chat. And at the very end of the presentation, you'll see a link for a survey, and there will also be a QR code. We would really appreciate if you would complete this survey for us. It just gives us some feedback and allows us to see what topics you would be interested in, what you liked about this presentation, and then what you think we could improve on. So if you are not familiar with using a QR code, if you have a smartphone, you can just open your camera and place it in front of the QR code, and then it will open up a link for you to whatever website it is that we're discussing at that point. So without further ado, I'd like to introduce Dr. Frene Lacour-Chestnut. She is an assistant professor at the Baylor College of Medicine, and she is also dual certified in both internal medicine and pediatrics. We are so appreciative for you giving this presentation for us today, and we're super excited. So feel free to begin.
All right. Thank you, Kayla, and thank you everybody for joining us. I'll be talking, I'm going to share my screen first so that I can pull up my presentation. And we'll be talking today a little bit about how to make the most of your telemedicine visit. We are all shifting gears and attempting to, as physicians and medical providers, attempting to offer more virtual visits to our patients in light of the COVID-19 pandemic. And we hope that more people will be able to access medical services through this mode of delivery of healthcare. So I hope by the end of this presentation that you'll have a little bit better idea of what it means to come ready to your visit, to your telemedicine visit, and hopefully that will make your visit flow more smoothly. If I can just get my slideshow started here. There we go. Make your visit flow more smoothly and get you the most bang for your time, as well as buck when you're interacting with your telemedicine physicians. All right. So to start off, I do not have any financial obligations. I was not paid for this presentation, and they represent my own views and not the views of my employer, and shouldn't be taken as medical advice for your own personal situation, but hopefully more so advice for your for yourself, but not medical advice. All right, by the end of this talk, I hope that you will be familiar with ways to prepare for your telemedicine visit so that you can get the most out of it, let you know which tools you'll need to most effectively allow your telemedicine visit to run smoothly, and then be able to rehearse at least one technique for ensuring that you understand by the end of your telemedicine visit what your diagnosis is and what you should do as far as your treatment plan moving forward. So telemedicine, basically the definition is the use of technology to deliver care at a distance. There are many different types of telemedicine. There are asynchronous, which we describe those as transmitting a patient's medical information maybe to a specialist, but it's not used in real time. For this particular talk, we will be talking about synchronous telemedicine visits. So either you are talking with your physician or medical provider one-on-one in real time, or you are utilizing video technology as well. So there are sometimes, now that the COVID-19 pandemic has occurred, that we used to have real difficulty as a primary care physician accessing real-time one-on-one video with our patients, as well as one-on-one audio visits with our patients. Because of the pandemic, there are lots of rules that were in place that have now been lifted and are allowing us as primary care physicians to connect with our patients using technology. There are lots of advantages to telemedicine visits for our patients and families who have limited access to care. So one of the first ways that telemedicine was used were in rural areas and for patients who don't have as access to physicians. So they would utilize telemedicine because they didn't have a cardiologist within 300 miles of their location. Well, now we know that even though you might have a physician's office right down the street from you, they might not be accessible or available during the time frames when you're accessible or available. So telemedicine has allowed us to work around. We have working families, you have patients who work shift work, and it's very difficult for them to get off of work to make it physically into the office for a visit. So this allows us to interact with patients and provide health care to those who would otherwise not seek care or seek care in an emergency room or urgent care setting. Now, there are some limitations. Technology failures are common. So some of those really limit our ability to function along with the patient. I had a little bit of a hard time making sure that my video camera or my webcam was working just now, since I'm in a different location than where I usually utilize this technology. So technology sometimes has limitations, but it's really used as a tool to expand our ability to provide healthcare. There are also certain situations when you need to do a physical exam. So not only do I need to physically see the patient, which I can do on video, but I need to examine a part of them that can only be done with listening through a stethoscope or palpating with my own hands or manipulating or performing certain maneuvers. So some of those limitations are there with telemedicine, although we've become very creative and there's new technologies that are coming out every day where patients can even have a stethoscope that could connect with their phone and they could put it to their chest and you can listen to their heartbeat and different things of that nature. So I look forward to some of that technology expanding our ability to perform telemedicine visits. Time is also a limitation. That's not only a limitation in person, but also with telemedicine, because you're even more beholden to certain appointment times and knowing that the patient is available and ready at this time. It's not like here in the office where my nurse can go and knock on the next door and say, excuse me, Miss so-and-so, Dr. Lacour is running behind. Is it okay? She should be here in 5 to 10 minutes. You don't really have that luxury when utilizing a telemedicine platform. So time is of the essence. And then previously with telemedicine, like I mentioned, there were so many barriers to providing primary care through telemedicine that you would have much more sporadic care and care that was fragmented. And we hope that with some of the new, many of the rules being lifted in terms of where you can provide telemedicine, who can provide telemedicine, and some of those limitations, that those will carry forward and we will better be able to provide continuity of care for our patients. So it would be okay, rather than a patient physically coming into my office, I could coordinate a lot of their health screenings, cancer screenings, and those things through telemedicine and not require the patient to come here and still continue that longitudinal relationship with a medical provider or with your physician that we know improves health outcomes. So we hope that that sporadic nature of telemedicine that used to be would be merged with continuity of care. With those thoughts in mind, we will move into our first tip. So I have 5 tips for you guys that hopefully will help you be better prepared, just kind of knowing the basics about telemedicine. So the first rule of the Girl Scouts, the motto for the Girl Scouts of America is to be prepared. So you all should be prepared whenever you enter your telemedicine visit. Ways that you should be prepared are writing down your specific concerns and symptoms. When did they start? What associated symptoms do you have along with it? And remember to write down your specific questions. For instance, if you are having a sore throat, how long have you been having a sore throat? Have you had anything like this before? Any other symptoms, that you have developed along with it? So do you also have runny nose, itchy eyes, any medications that you've tried for those particular conditions, and whether they helped or not? I say write them down, don't just have them in your head, because sometimes as you get into a conversation, you might forget, or it might take you a little bit of time to remember, oh, has it been 3 days or 5 days? So please try to write down your concerns and symptoms, as well as your specific questions that you don't want to forget. I recommend doing those things whenever you have an in-person visit with your physician as well, but it's even more important in that time-limited telemedicine visit. Also, you should write down your medical history, your medications, your pharmacy contact information. Your medical history is super important for you to have written down, because it's possible, like I mentioned, these might be sporadic visits. So the physician that you're seeing on your telemedicine visit may or may not have your full medical history. They may or may not know which medications that you're taking, if things have changed since the last time you saw your physician. So having all of those things written down is very important. One of the ways that you can keep track of all that, especially your medical history, what surgeries you've had, what medications, including names, dosages, and your pharmacy contact information, is by one of the women's health publications, is your personal health record. The publication is called How's My Health. It will allow you to keep track of all of those things. 5 years after you've had a gallbladder surgery, and then you had a C-section, you might have had some other minor procedures, you start to get a little fuzzy on the dates. So actually having that written down in your personal health record would be really helpful, so that you can keep track of those and provide that information in a succinct and concise manner when having your telemedicine visit. This How's My Health publication is available free of charge. Scan that QR code and you can download it yourself, or go to the link that's posted there at the Women's Fund, and you can download your own personal health record. The Women's Fund does have these available as print publications, but for right now, until we're able to kind of get back up and running and get back in our offices, you can download those for free. All right, so tip number 2, outside of being prepared by knowing all of your medical history and writing down your symptoms and concerns that you have, you need some tools. So you will basically be performing like the medical assistant. So typically our medical assistant takes the temperature, they check a blood pressure, they check your weight whenever you come into the office. But it's really helpful if you, as the patient, can, if you have access to those particular tools, that you would provide those vital signs yourself. So our vital signs, like we mentioned, are temperature, blood pressure, weight. Respiratory rate is also one of our vital signs. It's difficult for you to check your own respiratory rate, so I didn't write that down or ask you to do that. But if you are having a symptom such as shortness of breath or difficulty breathing or coughing, you can have someone else check your respiratory rate, and that will be done by basically having someone watch your chest rise and fall and count the number of times that you breathe in 30 seconds and multiply by 2, or breathe in 1 minute. And so they would just count that for you, and that's your respiratory rate. Now, your temperature is important. You need a thermometer to do so. Hopefully, all of us have a thermometer at home. But if you don't, it doesn't have to look like the thermometers that we have here in the office. It doesn't have to be a temporal thermometer, an ear thermometer. It can be very simple. A digital thermometer is perfectly fine. For our pediatrics patients, especially anyone under the age of 1 year, we prefer a rectal temperature or a core temperature. It's much easier to know what's normal and what's abnormal that way. So when we, as the medical profession, I guess, determined what a normal temperature was, we were using Celsius. And so 37 degrees Celsius is equal to 98.6 degrees Fahrenheit. In many of the studies that were done to determine what is a fever, they went by degrees in Celsius. So 38 degrees Celsius is 100.4 and 39 degrees Celsius is 102.2. Those are what we use to determine what is fever. That's why you see in a lot of the recommendations that are out now about testing yourself for fever, determining if you're at risk or possibly having symptoms for COVID-19, the determinations of fever a lot of times are 100.4 just because that's what 38 degrees Celsius is. So normal temperature would be anything below 100.4 when you technically define fever by some of our old studies. All right, the next thing that you'll need is a blood pressure cuff. So we prefer the arm cuff like you see here on the right photo, but if all you have is a wrist cuff, that works perfectly fine too. If you have either one of these devices, it would be great to have your temperature checked and your blood pressure checked and have that written down before you log on to see your physician on your telemedicine visit so that you know exactly what those numbers are. In patients with high blood pressure, heart disease, kidney disease, diabetes, if you're following up with your doctor on that telemedicine visit for any of those, or if you have any of those medical conditions, it would be very helpful for your medical provider to know what your blood pressure is. So checking that not only on a regular basis, but especially as you're entering that telemedicine visit will be helpful and allow the visit to flow smoother and faster. These are our guidelines for what's normal blood pressure. For the average person, normal is less than 120/80. And you can see here what's determined to be elevated versus high blood pressure. So high blood pressure now is anything that's greater than 130/80. And if your blood pressure is very elevated and uncontrolled, that is a reason to make sure that you're seeking medical care. And so telling your physician that on the telemedicine visit exactly what your blood pressure is will be very helpful, especially if it's high. All right, your pulse. Now, your pulse can be determined in a variety of ways. Many of us have a Apple Watch, a Fitbit, some type of fitness tracker, or other heart monitor that you can use to check your heart rate. If not, it's very simple to do so. So you just find with your index and your middle finger right in between, just below the inside of the wrist, right in between that tendon and the side of your wrist, and you can feel a little pulse there. You just want to press down very gently, and you want to use a watch and count how many beats for 30 seconds and then multiply by 2, and that's your heart rate or your pulse. Your heart rate or pulse, in addition to your blood pressure, is very important to help us determine hydration status. So if you are dehydrated, typically your heart rate will be elevated. And if you're severely dehydrated, your heart rate will be high and your blood pressure will be low. So these things are very important, especially if you have any acute infections, or in addition, if you have chronic conditions such as heart failure, heart disease, high blood pressure, or diabetes. So again, you are being the medical assistant with barely any training, but utilizing these tools will help you. So your weight is also super important. You don't have to buy a digital scale, a fancy scale, but keeping track of your weight, especially if you have heart disease, kidney disease, or lung disease. Those are conditions where you can gain fluid or weight very rapidly, and that would be dangerous to your health. In addition, for any pediatrics patient, for any child, we do need an accurate weight in order to dose a lot of medications and to prescribe them. So if you are conducting a telemedicine visit for a concern that you have for your child, please also get an accurate weight on them before that visit starts. And it'll allow the visit to also run more smoothly in case there needs to be medication that's prescribed. My second tip is setting the stage. So you don't want to be like the person on the left and have your battery die on your tablet, phone, computer in the middle of your telemedicine visit. So please, the first tip with setting the stage is to make sure your device is charged. It would be a disaster to have everything set up and you're ready to go to talk to your doctor, and in the middle of your explanation, your phone dies. So please try to do that. In addition, another way to help set the stage is also to make sure that you are connected to Wi-Fi, if at all possible. Make sure that you're in a well-lit area and avoid distractions. So you can see here that the physician has their computer, 2 screens up, one to see the patient, as well as another one for their electronic medical record. And you really want to have a well-lit area because your doctor may ask if you're having eye complaints. They might want to be able to see your eyes. If you have an area that you're concerned about, say you have a cut or something on your arm, make sure that you have on short sleeves so that you could easily roll up your sleeves or access the area that you have concerns about. So there are parts of the physical exam during a video visit that you do want to do. I also recommend having a little pin light or flashlight handy. If you're complaining of sore throat, you might need to utilize your computer, tablet, or phone and the flashlight to also manipulate so your doctor can do a little bit better physical exam and seeing what's going on in your throat. Now, when I say avoid distractions, this one for all of us during this time can be very difficult. So like many of you all, I have children at home who everybody is needing to utilize devices and they're talking, and there's lots of distractions right now because we're all at home. And it's very different from having your own privacy when you are here in the office. But if at all possible, make sure that you can close the door, turn off televisions, turn off radios so that you are focused and have that one-on-one private time with your physician to address your complaints. With that being said, make sure that you're not like this lovely gentleman, okay?
Scandals happen all the time. The question is, how do democracies respond to those scandals?
And what will it mean for the wider region? I think one of your children has just walked in. I mean, shifting sands in the region. Do you think relations with the North may change?
I would be surprised if they do. My apologies.
For the region.
My apologies.
So many of you may feel like that at home, and it's okay if it happens, but try to avoid distractions. Try not having your, children barge in on you if at all possible during your telemedicine visit so that you can focus in. All right, my fourth tip is managing expectations. So as a physician, as well as a patient, we both need to manage our expectations of what can actually be accomplished in a telemedicine visit. Typically, these are 15-minute visits. Like I mentioned, when you come into the office, it's possible that, you could flex a little bit of that time if someone needs more of you here in the office. But when you're online, you really have to kind of stick with this visit starts at this time and ends at this time. Therefore, you need separate visits for separate concerns. You need a separate visit if you, for instance, have diabetes and you are doing a chronic disease management visit with your telemedicine provider. So you are calling in to talk about the control of your diabetes, how your blood sugars are doing, how your, do you need refills on your medications, any complications from your diabetes. If you also have a concern, maybe you've been having some abdominal pain or some, you'd cut your leg or something like that, that would need to be a separate visit because you can't accurately and completely or fully really take care of both of those problems at the same time in one 15-minute visit. So just make sure that if you are following with your primary care physician via telemedicine, that you make separate visits for those separate complaints. Also, preventative medicine. Many of us experience and schedule the same things. We schedule our annual physical exam on a different day than you would come in for a sick visit. So just make sure that those are delineated and are separate, and don't expect that your doctor could handle all of it all at once, because similarly, just like in the office, there are some time constraints. And this mode of delivery of healthcare is new for most of us. So we have had to pivot very quickly into telemedicine on a dime. You know, there are many offices that within a weekend, they went from not having any telemedicine services to providing this mode of healthcare to their patients. And so we also understand that for patients, this is also a new mode of healthcare delivery for you. And I hope that those who listen to this talk will have a better understanding of telemedicine and also better be able to approach their visit, but many do not. So we are also trying to give each other some grace and learning the technology and what can and cannot be done. Sometimes there are just things that are not appropriate for telemedicine. Some examples of that when you should not use telemedicine are if you are having chest pain, if you're having severe and new shortness of breath, slurred speech, weakness in your arm or leg. Those are indicators that you might be having a stroke. And so that's not something that you want to sit and wait and talk to a doctor on telemedicine for. You do still want to go to the emergency room if you meet the criteria for FAST, right? If you have facial drooping, if you have arm weakness, if you have slurred speech, time is of the essence. That's what FAST is the acronym for. The same thing for new onset seizures or loss of consciousness. Now, this is not an exhaustive list, but those are examples of some scenarios where telemedicine is not right for you, and you should go to the emergency room if you're experiencing shortness of breath, chest pain, stroke-like symptoms, or new seizures. All right, my last tip is know before you go. That means before you leave that telemedicine visit, I want you to know what's going on with you and what you should do next. So you should know what your diagnosis is. What does the physician or medical provider think is causing your symptoms? And there's lots of times in medicine we don't know. So what are we going to do and work together as a team to try to figure out what is going on? So will there be labs or studies that are necessary? What are the top 2 or 3 thoughts as to what's going on with you? So what is your diagnosis? You should know that before you leave that visit. You should also know what your treatment plan or management plan is, what you should do next. So what also is the expected management of that particular condition? When should you expect to feel better after you've instituted certain management plans or started medications? And what you should do if you don't get better in that expected time frame, or reasons to seek higher level care. So one way that I usually teach my resident physicians and medical students to perform this with their patients, we call it teach back, is I like the resident physician and myself to ask the patient, after we've had this discussion, tell me what you understand is your diagnosis and what you should do next. So I want you as the patient to do that with your telemedicine physician before you leave that visit. Basically summarize to them, okay, doc, so you've told me that my condition is XYZ and that I should go and get these labs done and start this medication and that I should begin to feel better in this amount of time. And if not, this is what I should do next. So please summarize and teach back and utilize that technique when you're on the telemedicine visit, so that when you hang up the phone or you click off or leave your meeting, that you're not sitting there with questions that you have unanswered and you're unsure about. Because once that visit is over, it's not like here in the office that you can come back and ask a question, or you can ask the nurses, they're discharging you, different questions to ask the physician. Once that visit is complete, it's pretty much done, and you would need to schedule another one in order to have many of your questions answered. So know before you go. in summary, these are my 5 tips that we've discussed. Be prepared. Write down your symptoms and questions that will really help save you time during the visit. So you're not fumbling around trying to remember when your symptoms started and what's associated with it. Have your medications and your tools on hand. Try to take a full set of vitals if you have all of those tools. If you don't at home, that's perfectly fine. But remember, you can check your pulse yourself. You can check your weight if you have a scale, your temperature if you have a thermometer, and a blood pressure cuff, and have those tools ready just in case your doctor realizes that one of those readings is off and wants you to repeat it. And then also understand the limitations of telemedicine and what can and cannot be done during this environment. And then last but not least, know before you go. So knowing what your diagnosis is and what to do next will take you a long way. All right. So I hope that has been helpful. I know that we were posting questions in the chat. So I'm not sure, Kayla, if you want to give me the questions or if you want me to look in the chat.
I can go ahead and give you the questions.
Okay.
So the first question that we had is about wearables for heart rate. I know you mentioned the Apple Watch, the Fitbit, and you also mentioned a heart rate monitor. Is there anywhere specific that you could find a heart rate monitor? Is it a pharmacy or a grocery store?
So many of the heart rate monitors are considered fitness devices. So you can find them at many of the big box stores, Target, Walmart, Academy, and they usually have a strap that goes around your chest, and it has a little monitor that connects with a watch. So that's a heart rate monitor. Many people use that to track their heart rate when they're exercising to make sure that their heart rate isn't getting too high and that they're in a certain zone. I think it would be easier rather than getting that type of heart rate monitor to utilize a Fitbit or some other of the, I don't know all of the brand names, but pedometers that also have the heart rate monitor on there. There's also some apps that people utilize. They're more so on Android that they utilize the camera in order to check your heart rate. So they use like the LED light that's on the camera to check your heart rate. That is not as reliable. I know there's lots of buzz out there about utilizing those apps to check your pulse ox, which means your oxygen saturation that's in your blood. And those have not been shown to be as reliable for that. I would not recommend utilizing apps to check your pulse ox and going by that to determine when you should go to the emergency room if your oxygen level is dropping. There was actually a study that was done by the University of Oxford that looked at the apps that were available, and that study came out, I want to say like April 2nd, just in 2020, since it's been so common. So there's not as much data and it's not as reliable. It is reliable when your oxygen status is normal, but when it drops to abnormal, there's so much variability that it's not as accurate.
Okay, thank you. So the next question says, Dr. Lacour-Chestnut, you mentioned policies being lifted that has allowed healthcare providers to be more accessible for their patients. How can we ensure that these policies continue to allow healthcare providers to be accessible post-pandemic? And a second question in there is if there are any language barriers right now and if translators are available.
So I think I'll answer the translator question is a little bit easier than the first one, so I'll answer that one first. It depends on your healthcare provider in terms of contracting for translation services. So my particular healthcare provider, we have 24/7 translation services. So at all times I can call a interpreter and get any language available 24/7. Sometimes it takes a little bit of time, so that might also delay the telemedicine visit. Those are probably more so conducted via telephone rather than telephone and video. But I can have like I'm chatting with you guys on video, I could pull up on my cell phone my translator as well, so that we could have kind of like a three-way conversation. So we've been doing that. I am not a native Spanish speaker, and I have a lot of Spanish speaking patients, and so that's how we've been conducting those visits. The second, or originally the first question, which one is a little bit harder, how can we advocate to make sure that these policies continue? So I would for sure, it's going to be state by state. So CMS, or the Center for Medicare and Medicaid Services, has jurisdiction over patients with Medicare. Patients with Medicaid are under state control in terms of policies and regulations. And then there's also, from a medical board standpoint, what we as physicians can or cannot do that are regulated by certain states. So there's lots of players in this. And then in addition, for private insurance, many private insurances covered services for telemedicine, but they contracted out to certain companies, meaning, yes, if you are under XYZ insurance company, if you're insured by them, you can access whoever they've contracted out with this service to access telemedicine, but they wouldn't provide pay parity to accessing telemedicine with your own primary care physician, only if you accessed those services that they contracted out with. So I would say there's lots of different policies that have prevented primary care doctors from being able to provide these services for their patients on different levels. And so making yourself aware, advocating, writing to your senators about expanding those services for telemedicine would be very helpful. I'm sure in the coming months we'll see more and more. A lot of the rules for Center for Medicare and Medicaid Services that were lifted are in place until January of 2021, but there are state and local proceedings that we see are changing all the time. So we just have to keep abreast, and we appreciate when our patients also want to advocate for expansion of those services. So if as a patient your health has improved, or you've been better served by having these services available to you, please let your senators know, let your local leaders know.
Great. The next question is, should you email your medical history and medication list to doctor in advance of your telehealth appointment?
I would say not all email is HIPAA protected, meaning not all of your information is protected. There are certain telemedicine platforms where you can type in and upload, or your physician might have asked in a secure platform for your medical history. But if that's not asked, I would presume that your medical history would not be secure by just emailing it. I personally, our electronic medical record is different than my email. And so I prefer to receive medical records in my electronic medical record where I know my patient's information is secure, and there's a way to do that, versus if they were to email it to me, now I need to print it out, have somebody scan it in, and there's lots more options for not having your information be secure and breaking HIPAA. So I would say, if you have an electronic medical record where you can access to, where you can upload your information, or if there's a platform for that telemedicine visit where you can upload your information ahead of time. Otherwise, I would just have your own record. And so if anybody asks during that visit, if they're not available to access your information, that you would have it available for them. But email is just not secure enough.
Okay. The next question is, they start off with a compliment. This is much needed information. Do you provide these tips to your patients prior to their appointments?
So we, like many offices, have had to just pivot really quickly. So I have not had a forum to really provide these to our patients ahead of time. I'm hoping the Women's Fund and other organizations such as yourself will, and even lay people, spread the news, to your family members if they're going to have telemedicine visits, what they can do to prepare. As an organization, we have not sent out this information to them ahead of time. but definitely useful. And those personal health records will really come in handy. There are many of our patients who have relied on the fact that we have an electronic medical record here. And so they don't even have a list of all of their medications. They can't remember because last time they came to our office, they just said, well, it's in the EMR. So if you can imagine, if you've had a lot of medical procedures and changes in medications, that patients would be a little bit lost at home if they didn't have their own personal health records. So.
And the final question is, doesn't a blood pressure monitor have a heart rate reading on the screen?
Most of the times they do. If you have a blood pressure machine, usually it'll say pulse on there. That is correct. One more tip, I forgot to mention this, is that if you do have a wrist cuff or a arm blood pressure cuff at home, make sure that next time you do get to see your physician in person that you bring that with you. There are times, let me get that off the screen. There are times that, or I like my patients to bring it in so that we can make sure that the blood pressure readings that they're getting at home corresponds with the readings that we're getting here in the office. And so at least once a year, I ask my patients, when you come in, bring that blood pressure cuff that you have at home, just so we can make sure that it's tracking the same as ours. If there's always a 10-point difference, then what we're getting manually here in the office, then the patient at home will know that, hey, actually it's reading this, but I know that it's actually 10 points more or less than what they normally get in the office.
Okay, great. Well, I just want to give a little closing if there are no more questions. First, I'd really like to thank you again, Dr. Frene Lacour-Chestnut, for giving us this presentation. This information is much needed at this time. I know there are many people who are having to turn to telehealth visits and they're not familiar with it. And so I think having these tips will definitely make their visits go much more smoothly. And if you do have questions after this presentation ends officially, you can feel free to email those to the Women's Fund at healtheducator@thewomensfund.org, and we will direct any of your questions to Dr. Lacour-Chestnut. Also, I wanted to mention our social media pages. So if you would like to follow us on Facebook, we are the Women's Fund Houston. For Instagram and Twitter, we are the Women's Fund, and there we post information about our organization, different health information, and also information about events like this one and events that we have coming up. You can also find all of that information on our website at thewomensfund.org. And finally, for the survey, so this is the QR code and the link to our SurveyMonkey survey. If you could please complete this, we would really appreciate it. And we're going to use this information to improve our presentations in the future. And I just got a reminder from Linda to let everyone know that Dr. Lacour-Chestnut is on our board as well. So we really appreciate you taking the time out of your day to come and join in on this presentation. And if there are no additional questions, I am going to go ahead and end this meeting.
All right, let me stop sharing. Thank you so much for allowing me to present today. I hope that everybody at least got one tip that they can use in their telemedicine visits, and I look forward to any other questions.
Thank you.
Good day.
Thank you very much.
Thank you. Welcome.
Have a good day.
Bye-bye.
Bye-bye.
Bye.